Top 10 Essay Topics about Nursing Care Plan. Nursing Care Plans, the importance. The Nursing Care Plan is the primary document in which nurses record the treatment process. It is also a way to communicate and share information about a patient's condition with different nurses. The document describes each process step, helping nurses plan, implement, and evaluate nursing care. Experienced nurses often do this without documenting their actions. In your paper, you can focus on the importance of written and formalized nursing care plans. Nursing care plans and patient-centered care. Patient-centered care is not only about the patient's need for physical comfort, but also about their emotional well-being, personal values, and cultural traditions. For this approach, it is especially important that nurses exchange complex information about the patient with each other. In your paper, you could argue that the patient's preferences, cultural background, values, and socioeconomic status should be reflected in the patient-centered nursing care plan. Nursing care plan for a patient with schizophrenia. A nursing care plan for a patient with schizophrenia should be aimed at restoring the patient's self-esteem and rethinking their relationship to the personality. It should also include interventions aimed at establishing a nurse-patient relationship. Finally, some interventions are introduced to improve the patient's understanding of their personality by emphasizing the activities and hobbies they enjoy. Nursing plan of care for a senior. / older adults have unique and diverse needs. / in their most typical conditions are cardiovascular disease, hypertension, cancer, diabetes, obesity, and osteoporosis. There are also psychological changes people undergo as they age. In a paper on this topic, you should make a nursing care plan for a senior adult. Your plan should include their strengths, weaknesses, and the description of their special needs. Integrating evidence-based practice in nursing care plans. Evidence-based practice in nursing implies providing high-quality care based on cutting-edge research and knowledge rather than traditions, peer advice, or one's personal beliefs. How to integrate this approach into nursing care plans? Why is it important to use the latest research findings for nursing interventions? These questions are of great practical importance. The importance of collaboration in making nursing care plans. A good healthcare plan is more than just a list of a patient's symptoms. An effective plan should include a description of their personality, psychological state, habits, etc. Communication between nurses, their patients, family members, and other health professionals is necessary to create such a nursing care plan. How to organize such interaction? We invite you to consider this issue in our essay. Nursing care plans for post-surgical recovery. Postoperative recovery of the patient takes time. Part of this time the patient spends in the hospital, after which they return home in the absence of complications, continuing to follow the doctor's recommendations. We invite you to examine the components of nursing care plans for post-surgical recovery patients, ensuring optimal healing and minimizing complications. Cultural competence in nursing care plans. A truly effective nursing care plan must be personalized. That is, it must consider the patient's personality, cultural attitudes, socioeconomic status, etc. Therefore, cultural competence is essential for nurses. In your work, you might emphasize the importance of cultural competence in developing care plans that take into account the cultural beliefs and practices of patients. Evaluating the effectiveness of nursing care plans. The development of information technology has affected medicine. In particular, many new tools were developed to simplify collecting and saving information about the patient's condition. All this enhances the evaluation and measurement of the effectiveness of drug treatment. In your essay, you could discuss the process of evaluating nursing plan outcomes, including patient response to interventions and opportunities for continual quality improvement. Electronic health records and care planning software. Electronic medical records, EMRs, are a modern alternative to traditional patient records that record patients' conditions and reactions to medical interventions. EHRs simplify and speed up the process of recording information about the patient and reduce the risk of errors. How do electronic health records and care planning software streamline the development and implementation of nursing care plans? How do they enhance patient safety? These questions are worth discussing.